Lung cancer is the second most common cancer and the leading cause of cancer deaths in the U.S. Low-dose lung CT screenings help find cancers early when they're treatable and even curable. OSF St. Francis Medical Center is hosting a lung cancer screening event very soon with the hope to help those who qualify. I'm joined now by Shannon Foyles with OSF Healthcare's Cancer Center's Lung Cancer Program and Kristen Bales, an oncology nurse navigator. Good morning.
Morning.
Good morning.
Thanks for having us.
Thank you.
Thank you for joining us. So, Shannon, for those who don't know, what is a low-dose lung CT screening?
Yeah, it's really just a simple scan of your chest that uses the lowest possible dose of radiation to detect suspicious lung cancer findings. And it's painless and takes about 5 or 10 minutes.
So how does someone qualify for one of those screenings?
Yeah, so our patients have to be 50 or older to qualify for it. They have to at least have a 20-pack year history, so that means at least a pack of cigarettes for 20 years or a half a pack of cigarettes for 40 years. And they have to be a current smoker or a former smoker quitting within the last 15 years.
And is this covered by insurance?
Yes, important question. And yes, lung cancer screening is covered by Medicare and most private pay insurance as preventable. But OSF is on National Lung Cancer Screening Day, November 11th, offering these for free.
That's amazing. Wow. So for someone who might be interested, how could they find out more information?
Yeah, so for our patients that want to find out more information about it, they can call OSF Cancer Services, and our phone number is 309-308-0200, and they can pick option 3 to get more information about the lung cancer screening program.
So for lung cancer specifically, are there any signs that someone should look out for, or at what point do things get concerning, in you all's opinion?
Yeah, so as you pointed out, lung cancer is still the #1 cause of cancer-related deaths. And in fact, it more than the next 3 most common cancers, prostate, colon, and breast. So the reason for this is because most patients in early stage don't have symptoms until they progress. And when they do, those symptoms are a new or worsening cough. You might even cough up blood. A new or worsening shortness of breath, or what we call dyspnea on exertion. Patients may also have pain in their chest, or they may also lose weight without trying. And so the #1 thing we can do to try to prevent that, of course, is to quit smoking. And 80% of lung cancer is caused by smoking. So it's never too late. We want patients to know that. And as soon as you quit, that risk slowly starts to go down.
Yeah, and I know vaping is a big topic in this day and age. So do you all have any medical opinions about how this might impact getting some diseases?
Yeah, so still being studied. We don't have the research yet, but we are seeing certainly even acute lung injuries related to vaping. I know that right now we're still saying patients that vape for a short period of time to help them quit smoking. That's reasonable, but switching one habit for the other, certainly not. We certainly encourage people to both quit smoking and vaping if they can.
And would you all say, especially for those under 18, I know it's hard because it seems like sometimes kids under 18 still do have access to these products. So what would you maybe say to parents?
That's the hardest thing, is because it's really advertised for the younger generation. They put this out as, oh, this is a flavor that you can try, and they try to, advertise it as this would be good for you to try to inhale and stuff, and it's not. It's definitely not.
Yeah, and I think it's important for them to know these aren't regulated. We don't know where these are made, and you're inhaling these. Anything we inhale that can irritate the lining of our lungs and our lung tissue is not good for us.
Yeah, and what would you advise for someone who's maybe been a smoker for years and they're scared, to come in because they might feel that they have maybe some symptoms that you all mentioned? What would you say to them?
Certainly feel free to talk to your family doctor or your provider. That's an important thing. Don't ignore these symptoms. Again, to reiterate, the sooner we catch lung cancer, the better chance of outcome, the better chance of survival. So it's just really important for them to try to do their best to put that fear aside and get a hold of someone they trust, their provider or their family doctors.
Most definitely. And that's very comforting. So thank you both so much for providing so much information.
Yeah, thank you. Thanks.
We'll be right back.